Let's start with the big picture. What is mobile integrated healthcare and why does it matter?
Mobile Integrated Healthcare, or MIH, represents a shift in how we think about EMS and patient care. Instead of only responding to emergencies, MIH allows us to take a proactive, patient-centered approach that focuses on prevention, follow-up care, and improving long-term outcomes within the community.
So who oversees and supports MIH programs here in Indiana?
In Indiana, mobile integrated healthcare programs are overseen by the Indiana Department of Homeland Security EMS Division. This division supports the EMS Commission and helps guide MIH development, oversight, and implementation. Key leadership roles include the State EMS Director, State Medical Director, EMS Section Chief, and MIH Coordinator, all of whom help ensure programs are safe, effective, and aligned with state standards.
All right, let's define it clearly. What exactly is mobile integrated healthcare?
Mobile integrated healthcare is a patient-centered, community-based model of care delivered outside of traditional emergency settings. It is typically operated by EMS agencies, fire departments, or hospitals, and works collaboratively with healthcare providers and social services. The goal is to improve patient outcomes by focusing on prevention, early intervention, and addressing gaps in care that exist between traditional healthcare systems.
How does MIH actually help patients once they leave the hospital?
MIH serves as a critical bridge between hospital care and the patient's home. After discharge, many patients struggle with medication management, follow-up appointments, or recognizing complications. MIH providers help reinforce care plans, assess patients in their home environment, and identify issues early, ultimately improving continuity of care and reducing complications.
Can MIH help reduce unnecessary 911 calls?
One of the major goals of MIH is to reduce unnecessary 911 utilization. By proactively managing chronic conditions and addressing social determinants of health, MIH programs can intervene before issues escalate into emergencies. This not only improves patient care, but also reduces strain on EMS systems and emergency departments.
What about hospital readmissions? Does MIH make an impact there?
MIH plays a significant role in reducing avoidable hospital readmissions. Through early intervention, medication reconciliation, and reinforcing discharge instructions, providers can catch problems before they worsen. Communication with the patient's healthcare team ensures care can be adjusted quickly, leading to better outcomes and fewer returns to the hospital.
Let's clear up some misconceptions. What is MIH not?
It's important to understand what MIH is not. It is not a replacement for primary care or home health services. It is not intended to respond to emergencies in place of 911. And it is not a standalone program. It requires strong medical oversight and integration with the broader healthcare system to be effective.
When did MIH officially become recognized in Indiana?
Mobile integrated healthcare became formally recognized in Indiana in 2019 through state legislation. This law expanded the definition of EMS to include non-emergency care provided as part of an MIH program. This was a major step in allowing EMS providers to operate in a more flexible, patient-focused role beyond traditional emergency response.
How is MIH structured within Indiana law?
Indiana Code dedicates an entire chapter, IC 1631-12, to mobile integrated healthcare. This chapter outlines how MIH programs are developed, approved, funded, and regulated. It highlights the importance of MIH as a formal component of the EMS system across the state.
So how does the law actually define mobile integrated healthcare?
According to Indiana law, Mobile integrated healthcare is defined as community-based care delivered by EMS professionals outside of their traditional emergency roles. The purpose is to improve how patients use emergency services and to increase access to primary and appropriate healthcare, especially for underserved populations.
What goes into developing an MIH program?
When developing an MIH program, several factors must be considered. These include what services will be offered, whether additional training or certifications are needed, and how the program will be monitored and regulated. The goal is to ensure that providers are properly prepared and that programs operate safely and effectively.
What does the approval process look like?
To start an MIH program in Indiana, agencies must submit an application to the EMS Commission. A subcommittee reviews the application and may request additional information. Once the review is complete, the Commission has up to 90 days to approve or deny the program. Agencies also have the option to appeal if their application is denied.
Who is involved in reviewing and guiding these programs?
The MIH Advisory Committee is made up of representatives from across the healthcare and EMS landscape. This includes state leadership, EMS providers, hospital representatives, and other stakeholders. Their role is to review applications, provide recommendations, and help guide the growth of MIH programs statewide.
Let's talk about the actual submission process. How does an agency apply for an MIH program in Indiana?
The application is submitted through a Smartsheet form, available via the Indiana Mobile Integrated Health website. Once submitted, all applications are reviewed by the MIH Advisory Committee, which provides recommendations for approval. After that review, the application is sent to the EMS Commission for final approval. Once a program is approved, it is entered into a CADIS as a recognized qualification, and the program's information becomes available through the MIH website and dashboard for statewide visibility and coordination.
What kind of information is required when submitting an application?
The application process requires detailed information about the organization, leadership, medical oversight, and the services being offered. Agencies must also provide protocols, training requirements, and measurable goals for their program. Even if some elements are still in development, there must be a clear plan in place.
What types of services or initiatives can MIH programs include?
MIH programs can take many forms depending on community needs. Common initiatives include post-discharge follow-ups, chronic disease management, substance abuse and mental health support, and programs for high-risk populations like the elderly or newborns. The flexibility of MIH allows agencies to tailor services to the gaps in their specific communities.
How can agencies see what other MIH programs are doing across the state?
Indiana maintains a statewide map of approved MIH programs. This tool allows users to see where programs are located and helps promote collaboration between agencies. Since every MIH program is different, this map is a valuable resource for networking and sharing best practices.
What can you actually do with that map?
The MIH program map allows users to search by county, provider type, and initiative focus. This makes it easy to identify programs with similar goals or services and supports communication across the state. As programs evolve, keeping this information updated is essential for maintaining accuracy and usefulness.
That wraps up the overview. Any final thoughts or contact information?
Thank you for taking the time to learn about mobile integrated healthcare. If you have any questions or would like more information, please feel free to reach out to the contacts listed here. MIH represents an exciting opportunity to improve patient care, strengthen EMS systems, and better serve our communities.